And at 7:04, we want to dig a little deeper into that presidential diagnosis of chronic venous insufficiency. The president's doctor says the condition is benign, and they say that it's common in people over 70 years old. President Trump just turned 79.
Joining us to provide a closer look and more insight at the condition and its causes is Dr. Crystal Maloney. She's a vascular surgeon at MedStar Washington Hospital Center and joins us now to break it all down and tell us what this really means. Doctor, good morning.
Good morning.
First, if you could just give us a quick definition of exactly what chronic venous insufficiency is and what parts of the body are typically affected by this condition.
Sure. So chronic venous insufficiency is a chronic and benign condition. It is due to malfunctioning of the veins, most typically in the lower extremities. So in our veins, blood should flow from our toes back to our heart in a relatively uniform fashion at a reasonable rate. And in venous insufficiency, the blood flow gets to be slowed down. In our veins, we have valves that should prevent any backwards flow and should promote that reasonable rate of blood flow back to the heart. And when the valves become leaky, you have venous insufficiency.
Doctor, how does CVI differ from lymphedema?
So two different vessels. Venous insufficiency is involving a blood vessel, a vein, whereas lymphedema involves the lymphatic vessels. They can manifest very similarly with swelling, but lymphedema is a problem with the lymphatic vessels not flowing as well as they had been, whereas venous insufficiency is related to the veins.
We talked about age being a big factor here. We know the president is 79 years old, so we know who's really vulnerable here. But what's the treatment likely ahead? And we know that you're not treating the president, but in your expert opinion, what's the treatment and what happens if left untreated?
Sure. So when I meet patients who have venous insufficiency, the primary recommendation is to initiate a treatment pattern with compression, medical grade compression stocking, which is basically a snug sock you wear instead of wearing your regular sock during the day when you're up on your feet. What that does is promote the venous circulation. We'd recommend exercise. So every time you flex your calf, that's almost the heart of the veins. That promotes the venous circulation to return to the heart more quickly. And elevating the legs when you're at rest, when you can. If those measures don't take care of your symptoms adequately, then we do offer some office-based treatments to treat the symptoms. End-stage venous disease is a venous ulceration. So that's a really painful opening in the skin that's due to the increased pressurization of the veins slowly over time and an associated inflammation. And in those situations, we usually do get to procedures a little more quickly.
Doctor, we know that age has a factor in CVI, but are there any other ways that we can prevent this from happening?
Sure, yeah. So maintaining a healthy weight, exercise regimen, elevating your legs when at rest. Wearing compression stockings is a preventative measure for all comers. It does promote the venous circulation and it prevents a stretch from the veins that can happen slowly over time, as it does with all tissues as we age.
All right, that's Dr. Crystal Maloney. Thank you so much for spending some time with us.
Yeah, have a good day.
You too.
You too.